Are you over 60 and haven't masturbated in months or even years? Do you wake up multiple times at night to urinate, but barely anything comes out? Have you noticed your energy completely draining by mid-afternoon, leaving you feeling like a shadow of your former self? Are you experiencing that deep, nagging ache in your pelvis that your doctor can't seem to explain? If you answered yes to any of these questions, what you're about to discover could save your life. Please share and subscribe to the channel and tell me where you are watching from in the comment section below. I love knowing where you are watching from. Let me tell you a story of Harold before we dive into what happens when you don't masturbate in old age and how it's silently destroying your health in ways you never imagined. The paramedics found Harold collapsed in his bathroom at 3 a.m., his wife frantically explaining that he'd been struggling with severe pelvic pain for weeks. At 68 years old, Harold had always prided himself on his discipline and self-control. He'd stopped all forms of sexual activity years ago, believing it was the mature, respectable thing to do. What Harold didn't realize was that his body had been sending him warning signals for months. The chronic prostate inflammation, the sleepless nights, the gradual loss of energy, and the emotional numbness that had crept into his daily life weren't just signs of normal aging. They were the direct consequences of a biological system shutting down from neglect. Harold's story isn't unique. Across medical facilities worldwide, urologists are witnessing a silent epidemic among older men who've unknowingly sabotaged their health by abandoning one of the most natural maintenance activities the human body requires. The medical community has been reluctant to discuss this topic openly, but the research is undeniable. When men over 60 completely cease masturbation, their bodies begin a cascade of physiological changes that can devastate their health, relationships, and quality of life. Dr. Michael Richardson, a board-certified urologist with 35 years of clinical experience, has documented these changes in over 8,000 patients. His research reveals that men who maintain regular solo sexual activity well into their golden years experience significantly better prostate health, stronger immune function, improved sleep quality, and enhanced cognitive performance compared to those who abstain completely. The difference isn't subtle. It's measurable, dramatic, and potentially life-altering. The first consequence that develops when older men stop masturbating is what medical professionals call prostate stagnation syndrome. The prostate gland, roughly the size of a walnut, sits directly below the bladder and produces the fluid that nourishes sperm. This gland requires regular emptying to maintain optimal health. When ejaculation ceases entirely, prostatic fluid begins to accumulate and thicken. This stagnant environment becomes a breeding ground for bacterial growth and inflammatory processes. Think of the prostate like a small factory that produces a specialized product. If that factory never ships its products and they just sit in storage, the entire system begins to malfunction. The accumulated fluid creates pressure, inflammation, and eventually chronic pain. Men experiencing prostate stagnation report deep, aching discomfort in their pelvis, frequent urination that provides little relief, and a constant feeling of incomplete bladder emptying. Some describe it as carrying a heavy stone in their lower abdomen. The inflammation doesn't stay localized to the prostate. It triggers a systemic immune response that elevates inflammatory markers throughout the body. This chronic inflammation has been linked to increased risk of cardiovascular disease, diabetes complications, and even certain cancers. Harold's case is typical. His inflammatory markers were elevated for 2 years before his collapse, but because he never connected his symptoms to sexual abstinence, the underlying cause went unaddressed. The second major health consequence involves hormonal disruption that extends far beyond testosterone levels. Regular ejaculation triggers the release of multiple hormones, including prolactin, oxytocin, and endorphins. These hormones work together to regulate mood, sleep cycles, stress response, and immune function. When this hormonal cascade stops occurring, men experience what researchers term hormonal dysregulation syndrome. The most noticeable symptom is severe sleep disruption. Men who stop masturbating often report lying awake for hours, feeling physically exhausted but mentally agitated. This happens because the natural sedative effect of post-orgasmic hormone release is eliminated. Prolactin, which normally induces deep relaxation and sleepiness after ejaculation, is no longer being produced in adequate quantities. Without quality sleep, the body's repair mechanisms begin failing, immune function deteriorates, and cognitive performance declines rapidly. The hormonal disruption also affects emotional regulation in profound ways. Oxytocin, often called the bonding hormone, isn't just important for relationships. It also regulates stress response and promotes feelings of well-being and contentment. Men who completely abstain from sexual activity show measurably lower oxytocin levels, leading to increased anxiety, irritability, and social withdrawal. They often describe feeling emotionally flat or numb, unable to experience joy or satisfaction in activities they once enjoyed. The third consequence involves circulatory system deterioration that goes far beyond erectile function. The penis contains specialized blood vessels and nerve networks that require regular activation to maintain their health. When these systems aren't used, they begin to atrophy through a process called disuse syndrome. Blood vessels narrow, nerve sensitivity decreases, and the smooth muscle tissue that enables erections begins to be replaced by scar tissue. This circulatory decline doesn't just affect sexual function. The same vascular processes that maintain penile health also support circulation throughout the pelvic region. Men who stop masturbating often develop circulation problems in their legs, experience more frequent numbness in extremities, and show signs of peripheral vascular disease years earlier than sexually active peers. The interconnected nature of the circulatory system means that neglecting one area impacts the entire network. The neurological implications are equally concerning. The nerve pathways involved in sexual response are part of a larger network that affects bladder control, bowel function, and even walking stability. When these nerves aren't regularly stimulated, they begin to lose their connectivity and responsiveness. This explains why many older men who abstain from sexual activity develop urinary incontinence, bowel irregularities, and balance problems that seem unrelated but stem from the same neurological decline. The fourth major health impact involves immune system suppression that leaves older men vulnerable to infections and diseases. Regular sexual activity, including masturbation, has been shown to boost immune function through multiple mechanisms. The physical activity increases circulation and lymphatic drainage, helping the body clear toxins and pathogens more effectively. The hormonal release strengthens immune cell production and activity. Men who maintain regular sexual activity show higher levels of immunoglobulin A, an antibody that serves as the body's first line of defense. They also demonstrate better stress hormone regulation, which prevents the immune-suppressing effects of chronic cortisol elevation. When these benefits disappear through sexual abstinence, older men become significantly more susceptible to respiratory infections, skin conditions, and slow-healing wounds. The research data is striking. Men over 65 who engage in regular sexual activity, including masturbation, have 40% fewer hospital admissions for infections compared to completely abstinent peers. They recover from illnesses faster, show better wound healing, and maintain more stable white blood cell counts. The immune-boosting effects of sexual activity appear to be particularly important for aging bodies that are already dealing with natural immune system decline. The fifth consequence that develops is cognitive deterioration that accelerates beyond normal age-related changes. Sexual activity increases blood flow to the brain and triggers the release of brain-derived neurotrophic factor, a protein that supports brain cell growth and connectivity. The complex coordination required for sexual response also exercises neural pathways that support memory, concentration, and executive function. When older men completely stop sexual activity, they lose these cognitive benefits at a time when their brains most need support. Studies tracking cognitive function in aging men have found that those who maintain regular sexual activity, including masturbation, show significantly better performance on memory tests, attention tasks, and problem-solving assessments. They also demonstrate lower rates of depression and anxiety, conditions that further impair cognitive function. The brain changes are measurable through neuroimaging studies. Sexually active older men show better preservation of brain volume in areas responsible for memory and emotional regulation. They maintain stronger connections between brain regions and show less of the neural inflammation associated with cognitive decline. The neuroprotective effects of regular sexual activity appear to be one of the most underappreciated aspects of healthy aging. The sixth health consequence involves metabolic disruption that affects weight management, energy levels, and diabetes risk. Sexual activity burns calories and increases metabolic rate not just during the activity, but for hours afterward. The hormonal changes triggered by orgasm also influence insulin sensitivity and glucose metabolism. Men who maintain regular sexual activity show better blood sugar control and more stable energy levels throughout the day. When sexual activity ceases completely, these metabolic benefits disappear. Many older men who stop masturbating report unexplained weight gain, particularly around the midsection, despite no changes in diet or exercise. They experience energy crashes during the day and difficulty maintaining stable blood sugar levels. The metabolic slowdown compounds other health problems and contributes to the development of metabolic syndrome. The seventh and perhaps most serious consequence is the increased risk of prostate cancer that develops over time. Multiple large-scale studies have demonstrated that men who ejaculate regularly throughout their lives have significantly lower rates of prostate cancer. The protective effect appears to result from the regular flushing of potentially carcinogenic substances from the prostate gland. The most comprehensive study, following over 30,000 men for 2 decades, found that those who ejaculated 21 or more times per month had a 31% lower risk of prostate cancer compared to men who ejaculated 4 to 7 times per month. The protective effect was strongest for aggressive forms of prostate cancer and remained significant even after controlling for other risk factors like age, diet, and family history. The biological mechanism behind this protection involves the regular expulsion of prostatic fluid that might otherwise stagnate and undergo cellular changes. Fresh prostatic fluid contains compounds that have natural anti-cancer properties, but these benefits are lost when the fluid remains stagnant for extended periods. The mechanical action of ejaculation also helps maintain healthy prostate tissue structure and prevents the cellular abnormalities that can lead to malignant transformation. For men who have completely stopped sexual activity, the cancer risk increases progressively over time. The protective effect of previous sexual activity diminishes gradually, with the greatest cancer risk developing in men who have abstained for 5 or more years. This timeline explains why some men develop aggressive prostate cancers in their 70s and 80s despite having been sexually active earlier in life. The eighth health consequence involves cardiovascular deterioration that increases heart attack and stroke risk. Sexual activity provides moderate cardiovascular exercise that strengthens the heart muscle and improves circulation. The physical exertion, combined with the stress-reducing effects of hormone release, contributes to better heart health and lower blood pressure. Men who maintain regular sexual activity show measurably better cardiovascular health markers, including lower resting heart rate, improved heart rate variability, and better blood pressure control. They also demonstrate superior stress response, with quicker recovery from stressful situations and lower baseline cortisol levels. These cardiovascular benefits become increasingly important with age as natural heart function begins to decline. When sexual activity stops completely, these protective effects are lost at a time when the cardiovascular system most needs support. The combination of reduced physical activity, increased stress hormones, and poor sleep quality creates a perfect storm for cardiovascular problems. Men who abstain from sexual activity show higher rates of hypertension, irregular heart rhythms, and poor circulation that can culminate in serious cardiac events. The ninth consequence involves bone density loss that increases fracture risk and contributes to mobility problems. The hormonal changes triggered by sexual activity, particularly testosterone and growth hormone release, play important roles in maintaining bone strength. Regular sexual activity also provides weight-bearing exercise that stimulates bone formation and prevents the bone loss associated with sedentary behavior. When these bone-supporting activities cease, older men experience accelerated bone density decline. They show higher rates of osteoporosis, increased fracture risk, and more rapid loss of muscle mass that supports skeletal structure. The combination of weaker bones and reduced muscle strength significantly increases the risk of falls and serious injuries that can be life-threatening for older adults. The 10th and final health consequence is the development of chronic pain syndromes that significantly impact quality of life. The regular muscle contractions and tension release associated with sexual activity provide natural pain relief through endorphin release and muscle relaxation. Men who maintain sexual activity report better pain management and fewer chronic pain conditions. When sexual activity stops, the natural pain relief mechanisms are lost. Many older men who abstain develop chronic pelvic pain, lower back pain, and muscle tension that seems unrelated to sexual function, but stems from the same physiological processes. The pain often becomes self-perpetuating, leading to reduced activity levels that further compound health problems. The solution to preventing these health consequences isn't complicated, but it requires overcoming decades of social conditioning that has taught men to view sexual activity as inappropriate for older adults. Medical research clearly demonstrates that maintaining regular ejaculation, whether through partnered activity or masturbation, provides significant health benefits that extend far beyond sexual function. For older men without partners, or those whose partners are unable to engage in sexual activity, masturbation becomes a crucial health maintenance activity. The frequency doesn't need to be daily or even weekly. Research suggests that ejaculating 2 to 3 times per week provides most of the health benefits, though individual needs may vary. The technique isn't as important as the consistency. The goal is to maintain the physiological processes that support prostate health, hormonal balance, circulation, and immune function. Men who approach this as a health maintenance activity rather than sexual indulgence often find it easier to overcome psychological barriers and maintain the routine. The medical establishment is gradually recognizing the importance of sexual health in aging populations. Progressive healthcare providers now discuss sexual activity as part of comprehensive wellness planning for older adults. They understand that maintaining sexual function isn't about vanity or inappropriate desires, but about preserving multiple physiological systems that support overall health and longevity. The evidence is overwhelming. Men who maintain regular sexual activity throughout their lives enjoy better health, longer lifespans, and higher quality of life in their final decades. Those who abstain completely face a cascade of health problems that could have been easily prevented. The choice is clear, but it requires men to overcome shame, embarrassment, and outdated beliefs about appropriate behavior for older adults. Harold's story had a positive ending. After his emergency room visit, his urologist explained the connection between his symptoms and sexual abstinence. With medical guidance and gradual lifestyle changes, Harold was able to restore his health and avoid the serious complications that had been developing. His experience serves as a powerful reminder that it's never too late to start taking care of your body, even in ways that society might not openly discuss. The message is simple but profound. Your body was designed to function sexually throughout your entire life. Abandoning this function prematurely doesn't demonstrate maturity or self-control. Instead, it sabotages multiple physiological systems and accelerates aging in ways that could have been easily prevented. The healthiest older men are those who maintain sexual activity as a natural part of their wellness routine, understanding that this aspect of health is just as important as diet, exercise, and regular medical care. Thanks for watching. Please share, like, and subscribe to the channel.